Mark Manning here with Medical Management Services in Columbus, Georgia. I'd like to talk with you just for a couple of minutes today about the pros and cons of your anesthesia group being in-network versus out-of-network when it comes to covering surgery centers. Now, if your surgery center is in-network with all the major payers, Blue Cross Blue Shield, Aetna, Cigna, Humana, UHC, whatever commercial insurance payers are unique in your market, and then your anesthesia group is also in network with all of these major commercial payers, then everybody's probably happy. The surgery center's happy, the surgeons, and of course the patients. You're all in network. That's great. But you got to make sure you have really good anesthesia rates and pain management rates if necessary with your contracted payers. Do you need to review your payer contracts? Do any of your contracts have an annual price increase built in, what is sometimes also called CPI? Now, you might benefit from being out of network with some payers if the surgery center also is out of network. That way you're following suit. You're the same as what the surgery center is, and in some cases the surgeons might also be out of network that are working at those surgery centers. But is the center okay with that stance? If so, you might actually benefit. You might generate more revenue from some payers where you're out of network. How could that happen? Well, if you have a nice anesthesia conversion factor in place, then those out of network payers might actually process your anesthesia claims and allow them in full. Every now and then you might get a payment in full from those payers. But there are also some things to be aware of. You know, we live in a world of high deductibles now, whether you're in network, your patient's policies, or if their policies are out of network. They're all high deductible now. And the out-of-network policies are much higher with the deductibles than the in-network policies. So then, let's say your claim processes out-of-network, okay, the payer applies most or all of your claim to the deductible. Well, then you should be billing the patient, and then you're going to be billing the patient a much higher bill than perhaps they were expecting, or they perceive it to be a really high bill. And then it might be hitting them out of left field if they weren't informed ahead of time that your anesthesia group was out of network. So thus the buzzword we hear the last couple of years, surprise billing. This surprise billing has even gotten lawmakers involved to passing legislation. So we'll discuss surprise billing in another video. Now, is the insurance payer going to process the out-of-network claim? Well, they will. They'll process it. But then are they going to maybe send the payment to the patient? Depending on the patient's policy, they might do that. We've worked with groups where we've actually seen them attach a signed and dated reassignment of benefits form to their claim, and yet the insurance might still make the payment, send a check to the patient. Patient gets a check in the mail. Hey, look at this. Wow. Let me go buy a new Mercedes with it, or let me go buy whatever I want to with it. This must be my money. After all, I'm paying for that insurance policy, right? Well, then you got to chase the patients down for those checks, don't you? Now, we're also seeing more commercial insurance policies that are called MRC2 plans. And that means for out-of-network benefits, they limit the amount that they allow to your anesthesia claim based on Medicare pricing, or perhaps a percentage of the Medicare allowed amount. And you can't fight it. It's in the policy. Now, what if you want to be in network with a payer that the surgery center is out of network with? You just want to be a good citizen. Hey, you're telling your surgery center, we want to be in network with everybody. Well, we recently saw a group apply to be in network with a plan that the surgery center was not in network with, and the plan said, no, we're not letting you in because the surgery center is also out of network. So there are a lot of variables to consider when it comes to being in network versus out of network when it comes to covering your surgery centers, your anesthesia group covering surgery centers. Now, what about anesthesia groups when it comes to being in network or out of network with actual hospitals, brick and mortar, inpatient, outpatient, have an ER attached hospitals? Well, we'll discuss that, the pros and cons of that, in another video. So in the meantime, if there's anything at all that we can do to assist your anesthesia or pain management group or your facility that is responsible for billing anesthesia and pain management, give me a call. Mark Manning, 706-315-4660, and I'm sure we can find a way to help you. So in the meantime, thanks everyone, and y'all have a great day.